Good afternoon. My name is Destiny Fagundes, and I am a Level 2 nursing student at CNM. Today I'm stationed in your OB's office, and you had your first prenatal appointment today. During your first prenatal appointment, we learned in your history and physical that you are an active smoker. So you're sitting here in my office today kind of wondering what for, but this is just an educational appointment, and we're going to discuss some of the risks and some of the resources we have available to assist you to stop smoking while you're pregnant, to give you and your baby the best outcome possible. Okay, so I'm going to do some hand hygiene. I'm going to show you some of my educational pieces, and we're going to go over some of the resources, and then I'm going to do an evaluation at the end to see what worked well for you and what you retained, okay? Alrighty, so a piece of this, I'm going to be standing, I'm going to be showing you my whiteboards, and then we're going to be sitting down and discussing some more of these resources, okay? Come on with me. So first we're going to get started with some of the risks that are associated with the mom during pregnancy and also the baby. So my title on my whiteboard over here is Smoking in Pregnancy Risks. This is a mom smoking with a fetus in her uterus. Right here we're going to touch on at the end of the risk factors. This is the placenta. This is what supplies the baby with oxygenated blood, takes away all the waste from baby, and nourishes the baby throughout the pregnancy. This is what's vital for the baby and survival while in the uterus, okay? So first we're going to start with the risks associated with mom. This is also the same type of risks as if you weren't pregnant, but since you are pregnant, we're going to discuss the risks associated with smoking for the mother during pregnancy. First, you're going to notice that smoking can cause lung disease because when you smoke, there's all of these chemical wastes and tar and nicotine that builds up in your lungs and makes it harder to get oxygen into your bloodstream and get all that mucus and bacteria out of your lungs. Okay. The next risk factor to the mother while smoking during pregnancy is it makes your chances higher to have a stroke, because whenever you smoke, it constricts your blood vessels and makes them smaller and causes high blood pressure. And this makes things more likely to create a clot in your blood vessels, which causes a stroke. When you have a clot and there's an occlusion and they can't get any blood into that blood vessel, it causes all the other tissue on the other end of that blood vessel to die, okay? And also smoking creates a higher risk for cancer, esophageal, lung cancer, mouth cancer. Several cancers are associated with smoking. Those are the risk factors for mom. We're going to go over the risk factors for baby. So as I showed you over here, this is the placenta. It's highly vascular, and this is the umbilical cord. Again, it has veins and artery that feeds into the baby to give the baby all of its nutrients, all of its oxygenated blood, helps the baby grow. Okay, so whenever the mother smokes a cigarette, not only does it constrict her blood vessels and cause poor oxygenation for the mother throughout all of her body tissue, because it's making, again, those blood vessels so small, okay, so it causes things to build up in those blood vessels. But it also does that in the placenta. This is a very vascular sac and has so many different blood vessels. So the more these blood vessels get constricted, the less blood and oxygenated blood the baby gets. Less nutrients, less oxygenated blood. This causes low birth weight in the baby because it's not getting that good perfusion and good blood flow, and it's not being returned also. So not only do we see it struggling this way, but it's struggling going back, okay? This can lead to premature birth. It can be because the baby's not developing in the time frame that it should, so it's smaller for its gestational age than an average baby where the mother does not smoke. And also because this placenta has been damaged and caused calcification, so the baby is not getting adequate blood flow anyway, so the doctor's going to take the baby out of that environment because this makes a really poor environment for the baby to survive in. So whenever we have a premature birth, that's usually before 37 weeks gestational age, the baby's lungs are underdeveloped, so the baby more than likely will need a breathing tube or CPAP or oxygen. So whenever we have underdeveloped lungs, usually the baby has a feeding issue as well because they haven't developed a suck-swallow motion. So they'll have extra tubes like a feeding tube and an IV and a lot of other lines going into the baby. The biggest piece I have on the bottom here is whenever a mother smokes during pregnancy, the baby is 3 times more likely to die from sudden infant death per the CDC. And what that means is when a baby goes to sleep, there's a 3 times more likely chance for the baby to stop breathing and not wake up and essentially die after the baby is born. So this is the risks of smoking while pregnant. Not only is there significant risk factors for the mother, there's significant risk factors for the baby, for survival, for breathing, and just for survivability. Again, I'm going to emphasize that. So what we had created to assist, just for you to take home and to look at later, because I know this is a lot of information and it's really important, is a helpful brochure. And what's in this brochure is it's primarily targeted to pregnant women. But a lot of these just general risk factors like these ones can go for the average person as well who's smoking, okay? So within this pamphlet is the side effects of smoking per the CDC. Again, your risks to you and your baby, how your doctor will screen you, talking about what drives you to smoke, and some key factors on what we can look at in identifying to decrease some of those stress factors and create normal, healthy coping skills instead of going to smoking. Okay, and the biggest piece here is we have resources. We have local resources, we have online resources, and we have video testimonials from women that smoke during pregnancy and their journey with their baby that's in the NICU, all the lines, all the cords, what that looks like in an isolate, the big picture of an end result of an actual mother that smoked, her baby being born premature, and the impact it had on the baby as well. Okay, and on the end we have a follow-up on how we're going to take care of you throughout your pregnancy, how we're going to constantly be checking in with you on your progress and making suggestions on resources that will help. Okay, so it's not a one-stop shop. This is not one plan fits all, right? Everyone's their own individual. And we're going to be looking at many different resources for you that's going to work and be beneficial throughout a lifetime, okay? And on the back, we have a nice, clear, simple plan. We're going to go over that over here, okay? So over here it says, how can we help? Let's make a plan. So here we're going to sit down and make a plan with you, okay? It says, when I want to smoke a cigarette, I will. And this is a good plan to look at to hold yourself accountable. And it also helps us make suggestions that are healthy coping skills instead of smoking. Okay, so some of the suggestions is chew a piece of gum, take a walk, stretch, write a note, look at my ultrasound picture, and call my sponsor. And we'll touch a little bit more on that over here, okay? So over here we have resources. A big resource for you can call 24/7 is your OBGYN. That's your doctor, and also linked with your doctor is nurses like me that can help answer some of those key questions that you have that you may think about after the fact, okay? And also we have a 1-800-QUIT-NOW. This is a pretty good resource. You can call 24/7. Again, they provide with brochures, pamphlets, nicotine gum that you'll have to get cleared with your doctor if that's what you choose to use, online resources, text resources. Another one is counselors or cessation classes, and that's where you go and sit down and talk about other different things that drive you to smoke and kind of work out some of those key things, so you have a more beneficial long-term success in stopping smoking, okay? Online websites, those are included in the brochure, and the New Mexico Department of Health. It's very similar to 1-800-QUIT-NOW. It has a lot of those resources. So I'm going to sit down and we're going to go over this brochure a little bit more, okay, because I know that was a lot of information. So to evaluate your knowledge, I want to talk about what you learned for the risk factors that are not only associated with you, but associated with your baby. So again, remember for you, those risk factors were, 1, you have a greater chance of having lung disease, and what that looks at is being dependent on oxygen for a lifetime, right? So you have to carry some oxygen around with you for a lifetime. It makes you more at risk of developing lung infections, requiring inhalers, requiring medications routinely, puts you more at risk for cancer. That has all of its own medications and prognosis associated to it, right? But primarily, let's also focus on this baby. So the more you smoke a cigarette, the more greater your blood pressure is, less oxygen is going to the baby. So the baby's smaller, the baby's vascular system is more compromised, and you have a lot more risks associated to a premature birth. A lot of lines in baby, a lot more struggle and survivability rates for the baby, okay? So here's the brochure I was discussing, and we have plenty of these, so if you end up losing it, or if you want others for people you know, please feel free to pick up more or ask for more. In here we have the risks. We have, let's talk about how we can help. Okay, so you may not have questions today, but tomorrow, tonight, next Thursday, if you decide you have more questions, please feel free to call. On this side, we have resources. I included the videos and websites. We have local resources, online and text resources. These are the video resources of tutorials on the effects of testimonials of women on the effects of smoking while pregnant and their journey and their story, okay? Those are really impactful. Follow-up, how we're going to follow up with you during each one of your prenatal appointments, unless you need to talk to us sooner. And then on the back is let's make a plan, and you writing down a plan and what you think is going to work best for you right now, and we're going to reevaluate that your next appointment and see where your success is at the moment, okay? Well, it was nice talking with you, and I appreciate your time. I know this is a lot of information, but it's really beneficial on your health and your baby's health, and I'm excited to see where this journey goes and to see the outcome. Thank you.